everybody, my name is Carol Mack. This tutorial explains how to respond to a request for an accounting of PHI disclosures. The accounting rule is section 164.528 of the Privacy Rule. It has 4 provisions. Paragraph A is the patient's right to an accounting. The rule includes 6 years' worth of disclosures. The rule has 9 exceptions. The first is TPO, treatment, payment, and healthcare operations. Disclosures to the patient are not included. Authorized disclosures are not included. Permitted disclosures are not included. Certain public purpose disclosures are not included. Limited data sets are not included. Disclosures more than 6 years ago are not included. If PHI is disclosed to a health oversight agency or to a law enforcement official, the provider must temporarily suspend the accounting if they receive a written statement that the accounting is likely to impede official activities. But if the order to suspend is verbal, the provider must document the statement in writing and temporarily suspend the accounting for 30 days unless the verbal order is followed by a written statement. Paragraph B of the accounting rule specifies content. The accounting must include disclosures to or by business associates. It must identify dates and persons who received the PHI, and it must describe the PHI and give the purpose of disclosure. Multiple disclosures and research disclosures have additional specifications. Paragraph C specifies the time for response and costs. The provider must act no later than 60 days, but 30-day extensions can be obtained with a written statement of reasons for delay. Patients are entitled to 1 accounting per year without charge, but they may be charged for subsequent requests. Paragraph D specifies documentation the provider must retain. It includes information described in paragraph A, plus a copy of the accounting itself, plus titles of persons responsible. Now we'll see how the accounting rule works in Single Peak, California. The historic Plaza District is the heart and soul of the town. The Pruitt Medical Group sits on one corner of the plaza, and the dentist's office is on the opposite side. Dr. Dennis's wife, Linda, is a dental hygienist, and they work together at the office. Dennis and Linda are now walking over to see Dr. Hudson.
Hi, Belle. Thanks for fitting us into the schedule.
I'll let the doctor know you're here.
Hi, Dennis and Linda. Now, which one of you is the patient?
I'm the patient, but actually I don't need an exam. Could we sit down in the conference room?
Sure, follow me.
Dr. Hudson, on Sunday we had brunch. I bit into a baguette and broke a bicuspid. Fortunately, I married a dentist and we went over to the office. Dennis made a temporary crown and he gave me some Vicodin for pain. Unfortunately, the Vicodin wasn't strong enough.
So I called the pharmacy and prescribed Percocet. The pharmacist got on the phone and he told me he wouldn't fill the prescription. He said it was unethical to prescribe narcotics to my wife.
Doesn't he know Linda's been your patient for years?
I bet he thinks that I'm addicted to narcotics.
Yeah, that's possible. If he accessed your records, he would know I prescribed Percocet for you a couple of years ago.
But only once, and I didn't get any refills.
Let me know if there's anything I can do to help. I'd be happy to speak to the pharmacist on your behalf.
Oh, I would appreciate that, thanks.
You and I both know tongues begin to wag after newspaper stories.
It was awful, but the fire report cleared me of wrongdoing.
It was a defective gas flow meter, wasn't it?
Yes, there was an FDA recall. The dental board got involved, and the DEA, and the police, and the fire department.
That was embarrassing.
Yes, and I wonder who accessed my medical records. Do I have a right to get an accounting?
Well, the dental board told me to suspend your right to an accounting until they finished the investigation.
Really? I had no idea.
But that was months ago. I believe the suspension lapsed after 30 days because I never got the written statement required by Section A2.
Oh, good. So you can prepare it right away?
Yes, I'm happy to do that. HIPAA allows 60 days, but we can probably get it to you tomorrow. We retained all the documentation that's required by Section B of the Code.
What information is that?
We provide dates of disclosure, names of persons who received the PHI, and a brief description of each disclosure.
That sounds like a lot of information. You'll get it ready by tomorrow?
Yes, but it's not a lot of information. The accounting rule excludes TPO and incidental disclosures and informal disclosures allowed by Section 164.510. And there's a few other exceptions that don't apply.
Thanks, Dr. Hudson. But would you take care of my prescription now? My tooth really hurts.
Sure, I'll get the pharmacist on the phone. Your husband is the best dentist in town. There's no reason why you should have to go to someone else.
The accounting rule is rarely used, but a written plan of action should be included in your policies and procedures so you can respond quickly and easily if you receive a request. Thanks for joining me in this tutorial. Now I want you to meet my colleagues, Roman Diaz, President of Touchtone Compliance, and Karen Donral of Darnall Law Office.
We made these tutorials to help you learn about HIPAA and California law.
For individual attention, go to our contact page. You can send us a message or schedule a consultation.
And I'm Roman Diaz, President of Touchtone Compliance. Our online tools and expert services provide everything you need to successfully address HIPAA compliance. We identify vulnerabilities, provide a thorough risk analysis, and assist with mitigation plans, policies and procedures, and staff training.